Hey guys, my name's Dan. I'm a veterinarian, and are you stressing out over your doggy possibly having bone cancer or osteosarcoma? Osteosarcoma is quite common, actually. I see it on a regular basis, unfortunately. Let's talk over what it is and what to expect if your doggy has it. If you are stressing out over possible bone cancer, what you should be thinking is location to start with, guys. Location. It likes to live away from the elbow on the front legs or towards the knee on the back legs. So that means, if you look at my arm right here, guys, away from the elbow, that means it's going to live on the wrist or on the shoulder. Those are the two problem areas for bone cancer on the dog on the front leg. On the back leg, it's going to go towards the knee. So it likes to stay on the, we'll say, bear with me, the distal, the farther down part of the femur, or it's going to be on the proximal tibia, so towards the knee. If it doesn't always follow those rules, but that's a good start. So if you see anything hovering in those areas, we'll say it again, away from the elbow and towards the knee, that makes us more concerned. Now, if you have a large breed dog or a really big dog or a giant breed dog, and if the problem has been persistent for a long time, if you have a really firm, hot, warm swelling, if your doggy is non-weight bearing, not using the leg, and you can also have discharge. What a veterinarian is going to do is they're definitely going to take an x-ray. What a veterinarian will do is we'll take an x-ray, and they're going to x-ray the arm that's affected. They'll take multiple angles, and what they're looking for is changes in the bone. They will see lytic changes. The bone will be eaten away. This is totally different than having a broken bone. It's very easy to see. The bone will be like moth-eaten, very wispy, and it just looks like it's just falling apart like a broken or a rotting tree trunk. And as well, you could have pathologic fractures, meaning as it broke apart, it broke in places too. So you might have really fine break points, and you can also have very lytic and wispy areas as well. The bone just really loses its architecture, and it becomes really weak and soggy. Now, if this happens, you should take multiple angles of it, and then the one thing some people forget is you need to always x-ray the chest, because osteosarcoma bone cancer just unfortunately loves to migrate to the chest. If you take a picture of the arm and you see something, your veterinarian should and will take a picture of the chest. They'll take multiple views. They will do a right, left, and a VD, and by doing that, they're going to see if there's any lesions in the lungs. Unfortunately, guys, if you have changes in the lungs, you're in trouble. Like, you are in trouble. You probably have about a month, maybe. If there's symptoms, already coughing, you have far less than a month, and I'm super sorry to tell you that. If you have no lesions in the lungs, and it's just a leg, you may have between 3 to, oh man, I usually say 3 months. 3 months, maybe more. I've had dogs live longer, but the textbook is going to tell you have about 3 months if there's no lesions in the lungs, because they always say if there is bone cancer on the dog's leg, the textbook tells you it has migrated. You have microscopic spread already, and it's already in the lungs. You just can't see it yet. It's going to take time to develop. So if you have bone cancer in the leg, what do? You have a couple options. One, your veterinarian can always refer you to an oncologist. And they do have veterinary oncologists, doctors that handle cancer in doggies and kitties, and they do amazing jobs. And my goodness, they are brilliant and smart people. And if you're able to do that, if you have pet insurance, if you're financially able to do it, go ahead and do it. It's expensive. I don't have a lot of people that take that route, and that's okay. And I don't know if I could take that route for my own pets. So here's the deal, guys. You have two options. One, you can start medicines like NSAIDs, like piroxicam, that hopefully slow down the progression, reduce inflammation, help the doggy to feel better. And that is a good Band-Aid, and it's just going to buy you a little relief and time. Pain meds, NSAIDs, rest, not doing much. Just basically saying, I want to spend some time with you before we take you in to have you euthanized because you're really sick, and I just want more time with you before we decide to move forward with that. And that's okay. That's 100% okay. Other option, guys, is removing the leg. Now, as I said earlier, if you have a lesion on the leg and you have bone cancer in the leg, it is already in the lungs. It may be microscopic in the lungs, but unfortunately, it's already there. Removing a leg, all it does is it takes away the pain, and it allows for the doggy to be more comfortable as the disease progresses in the lungs. So you take the leg off, and if you have nothing in the chest, you can have a very comfortable, happy dog on 3 legs for 3 to 6 months. And as it progresses, as it gets worse, it may spread. I have had doggies live up to 9 months before, with a leg taken off and being pain-free, and then it moves to the chest. So we could live longer. But I tell everybody, if we take the leg off, you should expect hopefully 3 months, maybe up to 6 months, as it slowly spreads. If I have any lesions in the chest, the leg stays on. We talk about quality of life. We talk about hospice stuff, because it'd be inappropriate to put a doggy through a painful leg surgery and then expect them to then cough and be sick. So take the leg off. We live for 3 to 6 months, and we are comfortable. We are a happy dog. We are pain-free. And when we start seeing chest lesions, when we see it move to the chest, when we have coughing, that's when we say, at what point are we so uncomfortable that we need to talk about quality of life and euthanasia? Bone cancer is just one of those diseases where no matter how amazing you are as a pet parent, and no matter how good your veterinarian is, unfortunately nobody wins. And you can have small wins and minor wins, and you can have days that are good, and you can do things that help the doggy feel better. But in the end, bone cancer is one of those that is just incredibly disappointing for everybody. But if you think your doggy has it, if you have lesions like that on a leg, you should get it checked out, because you should be able to provide, support for your doggy, pain relief for your doggy, and if needed, a euthanasia, because that's no way to live if we are that painful with a broken leg. All right, guys, my name is Dan. I'm a veterinarian. I know that was a hard topic. I appreciate you guys listening and watching. If you have any comments, please leave them below. I greatly appreciate it. You guys take care. Bye.